to Module 3, where we will be reviewing Medicare. You may be wondering, what is the difference between Medicaid and Medicare? And I'm glad that you asked, because Medicaid is a government-sponsored health insurance program that's based on income. So in addition to meeting certain income levels, you need to meet specific eligibility requirements to receive Medicaid coverage. Whereas Medicare is also a government-sponsored insurance, but it is meant for persons who are 65 years and older, persons living with certain disabilities, persons that have kidney failure, or persons who've been diagnosed with ALS, also known as Lou Gehrig's disease. While Medicare can seem confusing, it's very important to have a basic understanding of how Medicare interacts with Ryan White. Nationally, about half of all Ryan White recipients were aged 50 and older. In 2022, here in Iowa, 25% of our clients were enrolled in the Iowa BDAP that had a Medicare plan. Coordination with Medicare is becoming increasingly important as more clients are aging into Medicare eligibility. The drugs are so good now that people are living a lot longer than they were 20, 30, 40 years ago. This is meant to be a general overview of Medicare, so we encourage you to consult with your agency's FBS for more specific details about your client's specific Medicare eligibility and benefits. While we don't expect you to be an expert in all things Medicare, we do want you to understand the different parts of Medicare. Part A of Medicare is hospital coverage. So this covers hospital stays like inpatient care, skilled nursing facilities, or hospice care. Most people are enrolled automatically into Medicare Part A. It does have a deductible of $1,632 a year. There is no premium if you have a work history. Otherwise, the premium is $505 per month. And while Part A covers hospital visits, Part B covers doctor and outpatient coverage. So this will often cover doctor visits, lab tests, preventative services, and durable medical equipment like wheelchairs, walkers, or other equipment. You must be enrolled in Part B or you will face a penalty. It does have a deductible of $226 and 20% coinsurance. Premiums generally have been around the $175 to $185 per month mark and are automatically taken out of the benefit check. So if someone is receiving Social Security, retirement, or disability, they will have that premium automatically deducted from their benefit. Part D is prescription drug coverage. This is purchased through private insurance companies that cover the cost of medications. You must enroll in Part D as soon as you are eligible, or you will face a penalty. This has a premium, a deductible, and cost sharing that can vary by plan. Some people would prefer to combine all parts of their Medicare coverage, their Part A, their Part B, and their Part D, and they would do that through a Part C or a Medicare Advantage plan. That combines all those parts into one private policy that's administered by an insurance company, not necessarily the government. Medicare will set the standard, but the plans vary in terms of their benefits and coverages. It does have an out-of-pocket maximum, which Part B does not currently have, and a Medicare Advantage plan could have an additional premium. For those people that would prefer to take original Medicare, which is Part A, Part B, and Part D, they're also eligible to buy what we call a Medigap plan, which is extra insurance coverage. This helps pay for things that original Medicare A and B does not cover. For instance, it covers the 20% coinsurance gap in Part B. You do pay a premium and you have a limited time to enroll when you first become Medicare eligible. For a better understanding of traditional Medicare versus a Medicare Advantage plan, we have put this together for you in a visual. Traditional Medicare is Parts A, Part B, Part D, and a Medigap policy if necessary. Or a Part C Medicare Advantage plan would include your Part A, your Part B, your Part D, and could include some additional benefits such as dental or vision coverage. Dental and vision is not provided by Medicare and is not a Medicare benefit. The BDAP will pay premiums for prescription drug plans, whether that is a Part D standalone prescription drug plan or a Medicare Advantage plan. All medications are billed to the client's Part D or prescription drug plan. BDAP then picks up the cost of the client's medication copay or coinsurance so long as it's not on our exclusion list. We do not have a monthly maximum for premium assistance. So over here on the right-hand side, you can see these are the things that we will pay for when a client has Medicare Part C or Part D. Medicare supplemental or Medigap plans are often named by letters, F, G, H. This help covers costs not covered by Medicare Part A and B plans like copays, coinsurances, or deductibles. These are purchased through private companies. There's a 6-month open enrollment period to buy a Medigap plan after you become eligible for Part A. As of January 1st, 2020, plans can no longer offer to cover the Part B deductible. So only those who already carry plans C and F can have that. There are no new enrollments for this benefit. BDAP can also assist with the cost of these Medigap premiums as long as we are paying for cost sharing for a client's Part D prescription drugs. When you first become eligible for Medicare, there are some logistics to figure out to proceed with your enrollment. An automatic enrollment usually takes place for Part A if you won't have a premium. So these are folks who are receiving Social Security benefits or a railroad pension, or those folks under 65 that have been entitled to Social Security disability for 24 months. At the time that you're enrolled in Part A, you're also automatically enrolled in Part B. The initial enrollment package is mailed out to you about 3 months before you turn 65 or before your 25th month of disability benefits. The initial enrollment package will also contain your traditional Medicare ID card. This is also called the red, white, and blue card. Medicare has specific enrollment periods. The initial enrollment period is your 65th birthday month plus 3 months on either side. So either 3 months prior to your birthday, the birthday month, and 3 months after your 65th birthday. You need to either enroll online or contact the Social Security office if you're not already receiving Social Security benefits. At this time, you would also enroll in Part A, B, D, Supplemental, or Medicare Advantage. If you would prefer, or if folks are eligible, they can enroll in the general enrollment period if they happen to miss their initial enrollment period. This is offered from January 1st to March 31st for Parts A and B. Then from April 1st to June 30th, you can sign up for a Part D or Advantage. Coverage will not begin until July 1st of that year. You may qualify for a special enrollment period if you have certain life events like a change in household or losing coverage. Usually it happens about 60 days before or after that event takes place. And there's also a 5-star special enrollment period. That means if a plan has achieved a 5-star rating from Medicare and it's available in your area, you can switch to that plan any time of the year. Annually, we have our open enrollment period. So once you already have Medicare, this is for making changes to your Part D or Medicare Advantage plan. That runs annually from October 15th through December 7th for coverage to begin the following January. It's really important that clients enroll in Medicare as soon as they are eligible. There are penalties if you do not enroll in your Medicare coverage at the time you are eligible. For Part A, if you have to pay for Part A, there's a 10% increase to monthly premiums, and you pay that for twice the number of years you didn't sign up while you're eligible. For Part B, there's a permanent increase in monthly premiums. So it's 10% for every 12-month period you didn't have Part B while you were eligible. There are some exceptions to this rule for Parts A and B, like if you were continuing to work and had coverage through your employer or through your spouse's employer. But simply having a marketplace plan through the Affordable Care Act is not an option to not enroll in Medicare. For Part D, if you go any period of 63 continuous days without prescription drug coverage, there's a permanent increase to your monthly premiums. So it's 1% of the national average premium times the number of months you didn't have coverage. Again, I cannot stress this enough. It is critical that clients enroll in Medicare as soon as they are eligible. The BDAP works very closely with your FBSs to ensure that someone enrolls in Medicare at the appropriate time. You may be thinking, gosh, Medicare seems awfully expensive, and it certainly can be. But for those that have Part D plans, there could be extra help available to them. It is known as the Low Income Subsidy Program and may help with the cost of premiums and copays or coinsurances. It can also waive that Part D late enrollment penalty if applicable. You qualify for this based on your income and resources. So in 2024, it was 150% of the federal poverty level. That is the same for 2025. And you can have no more than $15,160 in resources if you're single. Some folks get this extra help automatically at the time they enroll in Medicare, but anyone else must apply through Social Security. And since it's federally administered, this travels state to state if someone moves. So if you move from Iowa to Nevada, you will automatically have this extra help carried with you. There's also a quarterly special enrollment period, so you can apply anytime once per quarter for the extra savings help. So to recap, we expect you as the case manager to have a general understanding of Medicare. You will work with your agency's FPS to ensure that a client gets enrolled in a Medicare plan as soon as they are eligible. And if you do not have an FPS, the BDAP will assist you with developing a referral plan for your Medicare clients. We do try to track Medicare enrollment and we'll send out reminders as we are able. But we also expect that you collect all Medicare cards that a client has, and we appreciate your coordination with this effort. When submitting insurance verification documentation to the BDAP for a client who has Medicare, we are looking for the following. The original Medicare card, also known as the red, white, and blue card. This doesn't provide any prescription drug benefits, but it can help the BDAP and your FBS learn when a client was eligible for Medicare, and should they lose their Medicare benefits, it'll let us know the time in which they have to reapply. We would also like to see the supplemental Medigap card if the client has a supplemental plan. And we would also like to see the Part D prescription drug plan card. If your client is enrolled in a Medicare Advantage card, that information will be located on one card, and it should tell you that the plan is a Medicare Advantage plan. And this concludes our module on Medicare.